This is depicted on that slide here. We have relevant numbers of patients, cases and controls. We have samples for the DNA. We have samples of plasma and of serum where we can measure biomarkers. We do the genome-wide association studies for the several cohorts. And on top of that, we also try to align new cohorts in that Summit consortium. And we are ready for the first samples. More concrete, what did we do so far? In the work package 1, which deals with genetics, the first studies are already ongoing to identify novel genetic markers for diabetic nephropathy. In work package 2, which deals with the biomarkers, we have discussed a phenotype definition. We have discussed a list of biomarkers which we would like to test in the samples available. And we have also looked that for each of these biomarkers, assays are available at the one or the other partner, and this will be run very shortly. Work package 3 deals with novel imaging technologies, and we have already defined all the imaging technologies which we would like to use in our Summit consortium. We have developed, together with a new partner, also a new machinery gives us advantages over already existing imaging technologies. And we have done training courses to really align all the partners who do imaging, that they all really do exactly the same after the same standards and after the same procedures. Work package 4 deals with animal models, and what we have done so far is a review of existing animal models, and we will this will be ready for publication by the end of the year. We will make that available to the public, that we have a review on all existing animal models for diabetic complications. Work package 5 is the first work package which delivered already a deliverable into the consortium, namely a software and a handle to look for genetic markers and biomarkers in the discovery phase. And work package 6 is the umbrella over all the other work packages, dealing with training and dissemination, dealing also with the administrative stuff, which you should not underestimate in such a consortium. And to give you one example, what you could expect from Summit is that this already published work in the New England Journal of Medicine 2008 clearly describes that with gene scores, you can even be a little bit more precise than just measuring currently existing and currently accepted biomarkers and surrogate markers like the LDL cholesterol. Here it's, you can see, especially in the red line, that this gene score is predictive for the outcome of that patient, and that means on top of existing biomarkers, you can even be more precise than nowadays. And this is also something looking into the future. You see on top a normal histology of a coronary artery. And what you can see is that this artery is not a clean artery. This artery shows a atheroplaque in it, different phases of this atheroplaque. On the bottom, you see an intravascular ultrasound image. And in the middle, you see what we want to develop and what we will develop in Summit, a virtual histology, which gives us, even then if we use non-invasive imaging technologies, which gives us a picture of the plaque, of the arteries of the patient, and gives us also an idea not only on the size of the plaque, but more importantly on the composition of the plaque, whether it's a plaque which is a so-called soft plaque and will rupture in near future, which is very important to know and where we can intervene, or is it a solid plaque which is not nice to have, but is not detrimental or fatal. That will be developed in Summit. Coming to the consortium, we are a little bit smaller than the consortium from the previous speaker. We have 24 partners. We have 18 academic centers, 1 SME from Finland, and 4 pharmaceutical companies. The budget which we have from FPR is about 10 million euro in-kind contribution. The IMI funding is 14 million euro and the total cost is 28. And also on my slide there is a typo. We did already start 1st of November 29 and not 2010, so we are underway already more than half a year. Duration of that summit consortium is also 5 years. I think which also was seen at the other talks, we have a quite nice coverage. Not every country is participating, but a very nice coverage in mid-Europe. I guess in the previous talk it was evident that it's also a challenge to coordinate this large consortium. Also here I would say it's a challenge to coordinate 24 partners, but we can cope with that, and it's all about information and it's all about communication in that case. Here's a list of all the partners involved. You can see on the right-hand side the FPR partners, Boehringer, AstraZeneca, Eli Lilly, and Hoffmann La Roche. And it's difficult to read all the academia partners and the SME on the right-hand side. This is my last slide. I'm acting as the coordinator of that call, and the managing entity, as mentioned already, is Leif Grob from the University of Lund. I thank all the participants in the Summit Consortium. I thank you for your patience, and I'm happy to take any questions. Thank you very much.